So we are doing our final presentation on the prevention and management of COPD. For the clinical scenario, we have a 50-year-old male presenting with chronic coughing, shortness of breath, and wheezing. He mentions that these symptoms began 5 months ago and have progressively worsened. When asked about his lifestyle, the man explains that he has been smoking cigarettes since he was in his 20s. He also works on construction sites and confesses that he does not always wear a respiratory mask when there is dust present. It is determined that the man has COPD.
Some background information on COPD is that it is the fourth leading cause of death worldwide. It caused about 3.5 million deaths in 2021 and was approximately 5% of all global deaths. More than half of those diagnosed were women, and it was higher than average in American Indian and Alaska Native populations. Some underlying causes are smoking, secondhand smoke, air pollution, occupational dust, asthma and severe respiratory infections, and genetic issues like the alpha-1 antitrypsin deficiency. Some ways COPD is addressed is by medications like nebulizers, bronchodilators, steroids, and antibiotics. Some therapies are used as well: oxygen therapy, pulmonary rehabilitation programs, and ventilation therapy. And then there are some surgical options as well, like the removal of damaged lung tissue, a lung transplant, or a bulectomy.
The plan for prevention and management of COPD is to focus on three concepts. Those three concepts are the health model belief, the fog behavior model, and motivational interviewing. This will allow for prevention of the disease by using policy change and education to prevent people from picking up the habit of smoking tobacco. These will also have helpful tools to help people currently living with COPD and teach them how to manage it with healthy lifestyle changes, counseling, and education on things like inhaler use and breathing exercises for pulmonary health. Three of those bullet points, the health belief model is used to help people adopt preventative behaviors and improve self-management for diseases such as COPD. The fog behavior model makes sure it creates the foundation for patients to feel motivated and feel supported. Motivational interviewing is a counseling approach for treating COPD. Prevention is needed to help patients avoid COPD altogether. Some prevention steps include policy change, education, social media, and family communication. Disease management can include cessation programs, pulmonary rehabilitation programs, adopting a healthier lifestyle, community education, and education on the benefits of inhalers. All of these preventative and management tools will help patients with COPD or prevent patients from getting COPD.
Description of COPD is essential to address several key components. Here are a few. This is a very short list. Medications, the explanation and discussion of medications. Prescribing the appropriate medications is crucial for managing COPD symptoms and exacerbations. Common medications, which are numerous. These are just a few listed. Discuss the importance of adherence to medication regimes, not only with the patient's family or any support groups they may have. Pulmonary rehabilitation is also very promising, is very important. Program offer physical exercise education and support to help patients improve breathing techniques and increase exercise tolerance. This emphasizes in pharmacologic treatment is an integral part of managing COPD and has been shown to enhance physical functioning, reduce hospitalizations, and improve mental health.
So for the descriptional plan that we will implement for our scenario is that we have a 50-year-old male diagnosed with COPD with a history of smoking and exposure to dust in his construction job. Our plan focuses on a multifaceted strategy, combining lifestyle modification, counseling, and education for both prevention and management of COPD. So first, using the health belief model, we aim to help him understand the benefits of quitting smoking and using protective gear, especially the respiratory mask that he wasn't using, by emphasizing how these changes will reduce symptoms and improve quality of life. We'll incorporate health campaigns, and provider-patient discussions to ensure that the patient grasps the importance of these actions. Next model is the FBM, ensures we address motivation, ability, and triggers for a behavior change, that he changes his behavior for quitting smoking. We'll provide smoking cessation programs and inhaler demonstrations while using apps and messages to send regular reminders, ensuring he stays on track with his medication and lifestyle changes. And finally is the MI, motivational interviewing, will be used to explore his personal motivations, will help him connect with quitting smoking for long term, like job stability and health. This intrinsic motivation, combined with peer support group people in a similar situation and regular follow-ups, will guide him in managing his COPD effectively. So overall, all this plan will help him and provide him with education, counseling, and support, and routine checkups and follow-ups, ultimately promoting sustained behavior change and improved health outcomes.
And here are the references that we used throughout our presentation. Thank you.
Thank you.